Hey guys, Dr. Morse, Injury Experts. So we're going to talk tonight about a new advancement in Christian McCaffrey. So a tweet not too long ago reported that McCaffrey was in Munich, Germany, there visiting a specialist reportedly regarding his Achilles tendon injury. Now, this is definitely abnormal. If something is straightforward, as far as an injury is concerned, you don't have to fly to Germany to address it, especially in the middle of the season. Now, don't just take my word for it. I am a sports medicine physician that has the credentials to be a team physician. My mentor is a team physician. I understand what the resources they have, what our responsibility is, and what we can and can't do here in America. Taking it a step further, there are certain things we have here in America that we don't have access to compared to other countries like Germany, for instance. I'm going to take you back to a time about 12, 13, maybe 14 years ago, when a young elite basketball player named Kobe Bryant went to Germany to get something called Regenerative, which is a modified PRP. He eventually returned when he tore his Achilles, sound familiar, to get reportedly something called IRAP, which is a very strong protein type matrix that we get from stem cells, often our own stem cells, usually from our bone marrow, extracted, isolated, and injected directly into the specific area. Now, this very well may be what McCaffrey is there for. Now, I need you to understand something. Most of you may or may not know, I'm not just a regular sports medicine physician that takes care of older people and that takes care of high school athletes and does steroid injections and preps people for surgery or whatnot. My specialty is actually stem cells, regenerative medicine. I actually inject different versions of stem cells into patients every day. That's literally what I do. So there's not many more people qualified to talk about this than me. You know, I speak at stem cell courses lecturing about sports medicine and soft tissue injuries. So for me to say he has to go to Germany to get something is pretty substantial. Now, what types of things can he look for? Can he go out of his way to fly from San Fran all the way across the world into Germany in the middle of week 3, knowing that he's not going to play for at least a couple more weeks? Now, at the minimum, he's there to get evaluated by a specialist of a different caliber. Now, they can do MRIs here. We can do CT scans. We can do ultrasounds. Nothing's going to change in Germany. What can change is the access to a different type of treatment, where they're doing a different type of modified stem cell. They're doing a different type of stem cell that is not allowed here in America, an allograft type, a modified aggressive allograft that can be manipulated. Sometimes you see that in Panama or Colombia or Costa Rica or some of these other countries. And those other countries are a little bit risky. Germany is very good at what they do. So we don't have specifics. I would love to know specifics. But in general, this is more concerning to me than comforting. Why? Because think about it. He literally had to fly across the world in the middle of the season to address likely his Achilles tendon issue. So now he's dealing with 2 different injuries: the calf strain, which should be fine by now, and the Achilles issue. Now, the Achilles issue is likely 2 separate issues on its own. He has acute Achilles tendinitis, which in my opinion isn't a big deal. It is a precursor for bigger things, but in itself, it's not particularly concerning. He's likely dealing with acute on chronic Achilles injury, meaning he has an acute Achilles injury, Achilles tendinitis, inflammation of the tendon, but also a disorganization of the actual fibers as they come out. So the Achilles actually comes up in twists. So that's how it's structured from top to bottom. Now, the way that the disorganization can happen in these chronic tendon injuries, it can actually start to fray like a rope. So what can happen is you literally are running 50% rope, but you're asking the body to push it at 100% strength. So eventually over time, that rope can't handle that strength or that stress anymore. And what happens? Full thickness tear. So my suspicion is McCaffrey is there trying to figure out what they can inject to strengthen this up, but also allow him to play. I have never evaluated McCaffrey myself, but I know someone who has, and I know what type of stem cells he's used in the past. Those types of stem cells he cannot use right now because they're too inflammatory. PRP, taken from the blood, is too inflammatory and very weak compared to what he needs. On a scale of 0 to 10 in potency, PRP is about a 3. He needs about a 7, 8, 9. And he needs it multiple times. I do my injections in series of 3. I don't know what the docs in Germany are going to do or how they're going to do it, but I have significant concerns not only about his Achilles, but about his ability to play not only the rest of this season, but possibly indefinitely. Is there a possibility that he actually suffered such a significant injury that he may not be able to play again without rupturing his Achilles? I'm going to leave you with one final thought before we have any more information. Dre Greenlaw of the 49ers, before the Super Bowl, reportedly was dealing with Achilles tendinitis. And unfortunately, what happened to Greenlaw not too long after that, he tore his Achilles tendon. So if you have injury, you have inflammation, you have weakness in that tendon, you are predisposed to rupturing that tendon. And as we've seen for most running backs in the NFL, that's a game changer. That is likely a career ender or significant, delay. So I wish McCaffrey the best of luck. I hope he gets the answers he's looking for, gets the treatments he's looking for, and hopefully we will hear more in the next week or two to come. If you like this video, do me a favor, smash a thumbs up, subscribe, and check out some of the other content on our YouTube channel, TikTok, or even our website, theinjuryexperts.com. Thank you very much. Take care.